Fasting can have both positive and negative effects on individuals with diabetes, depending on various factors such as the type of diabetes, medication regimen, and duration of fasting. For people with type 1 diabetes, fasting can be dangerous and may lead to a life-threatening condition called diabetic ketoacidosis, DKA. This occurs when the body does not have enough insulin to process glucose and starts breaking down fat for energy, leading to an accumulation of ketones in the blood. This can be exacerbated during periods of fasting, as the body may rely on stored glucose and fat for energy. For people with type 2 diabetes, fasting may have some potential benefits. Short-term fasting has been shown to improve insulin sensitivity and lower blood glucose levels in some individuals with type 2 diabetes. However, long-term fasting or severe calorie restriction can lead to muscle breakdown, which can negatively impact insulin sensitivity and increase the risk of hypoglycemia, low blood sugar. It is important for individuals with diabetes to consult with their healthcare provider before attempting any type of fasting or dietary changes. In some cases, medication adjustments or close monitoring may be necessary to ensure safety during periods of fasting. The National Health Service, NHS, in the UK recommends that individuals with diabetes should speak to their healthcare provider before attempting any type of fasting. They also suggest that those who choose to fast should be aware of the potential risks and take steps to manage their blood glucose levels during the fasting period. The NHS advises that individuals with type 1 diabetes should not fast, as this can increase the risk of diabetic ketoacidosis. For those with type 2 diabetes, they suggest that fasting should be limited to a maximum of 24 hours and should be done under the supervision of a healthcare professional. The NHS also recommends that individuals with diabetes who choose to fast should monitor their blood glucose levels frequently and have a plan in place to manage hypoglycemia, low blood sugar, if it occurs. They should also be aware of the signs and symptoms of hyperglycemia, high blood sugar, and seek medical attention if necessary. In addition, the NHS advises that individuals with diabetes should not fast if they are unwell, pregnant, breastfeeding, or have a history of eating disorders.